So there was a recent phase 1 clinical trial with an inhibitor of the CXCR4 receptor called Plerixafor, which is a drug that is used for mobilization of hematopoietic stem cells for transplantation of patients with lymphoma or myeloma. And in this trial, Plerixafor was used in combination with Rituximab, but the overall response rate was relatively modest and not much different to what would be expected for treatment with Rituximab alone. However, treatment was of very short duration, and since this was a phase 1 clinical trial, many patients received rather low doses of Plerixafor. So additional studies will be required to determine the potential efficacy of this drug in patients with CLL, particularly as a sensitizing agent in combination with other more potent CLL therapies. Regarding drugs that target macrophages, so there are a number of small molecule inhibitors and monoclonal antibodies that target the colony-stimulating factor 1 receptor, which is a receptor that is involved in regulating the differentiation of monocytes into macrophages. And these drugs, several of these drugs, are currently being investigated in certain cancers, although to my knowledge, not yet in CLL. However, another approach to prevent interactions between the leukemic cells and macrophages is to target the BAFF receptor, which is a molecule that transmits growth and survival signals from macrophages to the leukemic cells. And several anti-BAFF receptor monoclonal antibodies have been developed recently, among which two are currently being investigated in combination with Venetoclax and Rituximab, or in combination with Ibrutinib in clinical trials of patients with chronic lymphocytic leukemia.